Every nursing student dreads this checkoff, but once you break it down, it's really not that bad. Welcome to Healthcare 101, how to do a head-to-toe assessment. Little disclaimer, every program does it a little bit differently, so make sure you read through your school's rubric. All right, the assessment started, you've entered the room. First, introduce yourself. Hi, I'm Marina. I'm the student nurse going to be taking care of you today. Then confirm you have the right patient. You could check their wristband, but if you ask them their name and date of birth and they can tell you, that's a great way to check cognition as well. Next, check that they're alert and orientated. Are they able to sit up? Answer your questions. Do they look like they're awake? Before you touch the patient, hand hygiene. So either washing your hands or hand sanitizer, close the curtain to provide privacy, or verbally say, I'm going to do everything in my power to provide privacy at this moment. And then position the bed safely. You want to raise that bed up so it's at hip height. That way you're not bending over to hurt your back. Next, you're going to do vitals. Pretty simple: blood pressure, heart rate, respiration rate, oxygen saturation, and temperature. Never tell a patient that you're counting their respiration rate, because then they're going to think about their breathing and that might alter the actual reading. Then it's a good time to ask your two subjective questions. Do they have allergies? Are they on any medications? Do they have a history of smoking or cardiovascular disease? Next, it's time for the visual inspection of the patient. How does their skin look? Are they pale? Are they red? Are they gray? Then look at their nails. It's a great way to tell perfusion. Are their fingertips white? How's their cap refill? And how's their breathing effort? Is it labored? Is it easy? Speaking of breathing, let's check those intercostal muscle movements. These are the muscles along the ribs. If they're working quite heavily, it could mean the patient's struggling with breathing. Then let's actually listen to the lungs. So make sure you check the front, the back, and the side. When you're checking the side, make sure you're lifting the patient's arm. Then check your neurovitals, including your GCS. And just like that, the physical portion is done. Now you can ask the patient if they have any questions, and make sure you lower the bed back down. A patient rolling off a bed because you forgot to lower it could be a reason you fail. Don't forget, you need to do 2 interventions as well, like checking their oxygen saturation or repositioning in the bed. That's your full head to toe, simple, structured, and safe. I have a checklist for head to toes. If you want it, DM me. Should I break down vitals or neurochecks next?